Okay, this next video and then the second part of this video will also talk about the treatment of the psychological disorders that we have just talked about. We're going to talk about a number of different treatments. And the thing that I want you to really know about these treatments is that most people who are receiving treatment for a psychological disorder are receiving multiple types of treatments, multiple different types of therapies that are used in conjunction with another in order to find the best treatment plan for that person. So keep in mind that usually these treatment plans are not used individually, they're used with one another. So let's look at the history of some of the treatment that was done. Most of the early treatment of psychological disorders was dangerous. They were doing things like lobotomies and bloodletting and lesioning the brain and drilling burr holes into the skull in order to let the demons out. So a lot of the treatments that were originally used were really not humane, and they were debilitating to the people. And so along came Philippe Pinel in France and Dorothea Dix in the United States, and they founded a movement to really treat people with mental illness in a humane way. And so this photo you can see is Philippe Pinel actually telling the people of the insane asylum to take the chains off of the women because there needed to be humane treatment. So the different types of therapies that we're going to talk about are psychotherapies, which are kind of what you think about when you think about therapy, right? A patient sitting in front of a therapist and they're talking about emotionally charged things and they're trying to come up with a way to get around it. And that is the main idea of psychotherapy. However, there are some other types of psychotherapy as well. Biomedical therapy is going to be drug therapy for the most part, although it does include some types of surgeries that can help with psychological disorders. And then finally, it's the eclectic approach, which I talked about before. The idea that you're going to use various forms of healing techniques in order to really get down and dirty and help that person along through their journey. So we're going to talk about psychotherapies first, and then we'll get into the biomedical therapies after. So the different type of psychological therapies we're going to talk about go along with the different approaches to psychology that we talked about in Unit 1. So think way back to that unit and these different ideas or approaches to psychology that we've talked about. So psychoanalytical, humanistic, behavioral, and cognitive. Think about those buzzwords that we talked about when each of these four therapies come up. Okay, so the first is psychoanalysis or the psychoanalytic approach. The buzzword here, remember, was unconscious. And so this was the first formal type of psychotherapy. Freud came up with it. This is his famous couch that he used, and he came up with it because he was dissatisfied and not happy with hypnosis, which was being used at the time. He came up with an idea called free association, which we've talked about already. And this was the idea that they're going to unravel the unconscious mind and the conflicts that come with it. Okay, so the patient lies on a couch and just says whatever comes to their mind. And during this time, the patient is actually going to unconsciously edit through his thoughts and resist some of those feelings and emotions that are wanting to come out. And that resistance is what the therapist is looking for, okay? They're seeing, oh, he's resisting feeling angry about this particular topic. That might be something we need to focus on, right? To bring out that anger that he's resisting, okay? And eventually the patient is going to open up and reveal their innermost feelings and thoughts to that therapist. And in addition to that, that person can develop positive or negative feelings towards the therapist. This is called transference. And it's when that patient transfers those feelings of anger or desire towards that therapist. Okay, so that can sometimes happen. Some of the criticisms of this type of therapy are that it's really hard to say whether or not this is working because we can't prove or disprove that something actually happened for that person. It's not an objective, scientific type of therapy. So that's one of the criticisms. It also takes a really long time and is expensive because we are relying on one psychoanalyst with that person. That person, the patient can't take homework home, right? And do this. They have to have that psychoanalyst there. So currently, some psychodynamic therapies are still used. We still use face-to-face therapy, and it's really to kind of understand the symptoms and the themes of where these feelings and emotions are coming from. We call it interpersonal therapy or psychotherapy. It's kind of coming along with, okay, getting down to the reasons why someone is feeling certain emotions. So getting to the root of their emotions or their struggles that they're having, and then dealing with that anger or that desire or whatever it might be in order to help that person cope. Okay, so focusing on that symptom relief of anger, depression, sadness, et cetera, and then having that person move on from there. The next type of therapy is the humanistic therapy. Remember the buzzword here. This is the kind of hippie idea of, or a hippie approach, right? So this is aiming to boost self-fulfillment, helping people grow in self-acceptance and self-awareness. Carl Rogers was the important person here that you need to remember. He came up with person-centered therapy, oftentimes called client-centered therapy. And this is the idea where the therapist is going to sit and listen to what you are saying and really acknowledge that it is okay that you are feeling that. They use active listening. So this is the idea where someone would say, you know, I was at school and I got really angry at my teacher because she handed back my test and I got an F. And so the therapist might say, so what I'm hearing is that you were angry because of your failing grade, but you decided to take that anger out on your teacher. Right? And so that person is then going to clarify and acknowledge that, yes, you were angry. It's okay that you were angry. Let's figure out the reason why. Okay? Okay, the next type of therapy is behavior therapy. So behaviorists, remember, this is when we talked about learning, observable behavior. So behaviorists are focusing on looking at the actual behavior that someone is doing and changing it. Okay, so changing maladaptive or bad behaviors and replacing it with appropriate behaviors. They're not really looking to figure out the why. Behavior therapists don't really care why you are acting a certain way. They just want to change how you are acting. So this oftentimes is used to treat phobias or sexual disorders. Phobias because do we really care why you're scared of spiders, right? Do we really care? No, it doesn't really matter. But we do want to change your behavior when you're around a spider, when you think of a spider. That's what behavior therapy does. Oftentimes, behavioral therapists are going to use operant and classical conditioning techniques. The first type of techniques that we're going to use or that we're going to talk about is classical conditioning. Remember, these are those involuntary actions or behaviors that we do that we want to change, right? And so instead of conditioning us to have a fear response, we're going to counter condition. We're going to train our bodies not to have that fear response, okay? So instead of conditioning us to be afraid of that white rat that like little Albert was, right? We're going to counter condition. We're going to train little Albert to not be afraid of the white rat. And the two different therapies we're going to talk about are exposure therapy and aversive conditioning. Exposure therapy is what we're going to talk about first. This is when we are exposing or putting someone into a situation where they're going to have a fear response. And over time, after having that fear response over and over, that person is going to eventually habituate, okay? Their anxiety is going to lessen, and they're not going to have that psychological or emotional response, okay? So a kind of silly example of habituation. When Frozen, the movie, first came out in 2013, I loved it, right? I loved every minute of it, every song, because it was the first time I had seen it. I had this really emotional response. I really loved it. And then over time, once I had children and they started watching it every single day, multiple times a day, and singing Let It Go, I've habituated to that movie. My emotional response towards that movie has diminished, right? It's gone away. It's not so great anymore. First time you hear a song on the radio, you're like, yeah, this is awesome. I love it. And then you've heard it 500 times and you're like, ugh, this song again, gotta change it. That's habituation, okay? And with exposure therapy, it's oftentimes called flooding because we put someone into a situation where they're going to invoke this fear response, this anxiety, and then get them to a point where they can reach that peak anxiety and now calm themselves down. And this is done over and over again until that peak anxiety starts to lower, okay? And then eventually their baseline anxiety when they're in that situation is going to be much lower than it was at the beginning. That's what flooding does, okay? We can use flooding in real environments or virtual environments. It really just depends on the situation. It's oftentimes used for patients with PTSD because, especially virtual, because we can't really put them into a combat zone again. Another type of exposure therapy is systemic desensitization, or systematic, I should say, not systemic, systematic desensitization. And this is where instead of just putting someone fully into that situation and having them reach a very peak anxiety level, we're going to take baby steps in order to get to that fully anxiety-provoking situation. So instead of starting in a full combat zone, we're going to have that person start with baby steps, okay? And in order to do that, they need to establish the anxiety stimulus hierarchy. And so the first thing they're going to do, this example is giving a presentation or speaking in front of a class, okay? So the first thing would be, okay, the first thing that might cause anxiety is identifying your topic for presentation, okay? So let's do that. Let's think about how we feel. Let's bring that anxiety down. Let's habituate to that anxiety about that first level, and then we'll move on to the next thing, okay? So we are going to work our way up to that highest level of anxiety. As each person is slowly exposed to each level, they are relaxing, they're lowering their anxiety response, that sympathetic nervous system, and eventually they're not going to be as afraid. Okay, the next form of classical conditioning techniques for behavior therapies is aversive conditioning. It's also called aversion therapy, and what it does is it's associating an unpleasant state with an unwanted behavior. Okay, so the behavior in this case is drinking alcohol, and instead of you getting the buzz from the alcohol, they're going to lace your alcohol with a drug that's going to make you nauseous and throw up. Okay, so you drinking that alcohol, that behavior of drinking the alcohol is going to be conditioned with the feeling of nausea, and you're not going to want to do that behavior. Okay, so that's aversion therapy. It's also used sometimes with sucking your thumb. The behavior of sucking your thumb, in order to do that, would be to put like a coating on your thumb that's going to taste really bad, put it in your mouth, and you're going to condition yourself to, or associate the idea of sucking your thumb with that yucky flavor, okay? The next video, we're going to go on to operant conditioning techniques and then some of the other therapies, the cognitive therapies and biomedical therapies in part 2.